Okay. Yeah. Thank you so much. Thank you for joining, everyone. Good evening, good morning, good afternoon. Our distinguished guests joining us from all parts of the world. We are really delighted and happy that you made it today. Today is a great day. We are talking about mental health. I mean, everybody wants to be healthy, not just physically, but also mentally, spiritually, emotionally, name them. And today, on behalf of the Global Alliance for Sustainability in Education, that is GASE, and the Women's Indian Chamber of Commerce and Industry, that is WISI. Is it WISI or WIKI? You will correct me in that. It is my great honor and privilege to welcome all of you to this very special edition of the Global ESG Talks for 2026. So we are climaxing the Mental Health Month in a special way, in a unique way, and we want to thank God because of this privilege. Today we gather under the timely and transformative theme that everybody in the world would love to listen to. Everybody in the world would love to be part of. We are talking about mental health. We are talking about ethics. We are talking about sustainable futures. Now, because we are basing all these in the field of education for sustainable development, I would like to talk about what is ESG and why are we talking about this in this platform where we are sensitizing the world about sustainable development, especially in the line of education. Before we get there, allow me to request one of our friends, Veni Mogaka from Kenya, to just say a simple word of prayer for us. With due respect to everyone, it doesn't matter your religion. We appreciate you with your religion. Just allow us to do it the Christian way for today. Veni, please, unmute yourself.
Okay, good evening, everyone.
Good evening.
I hope
Good
you're
evening.
getting me. Thank
Yes.
you. Now, let's believe and pray. Our Father, in the name of Jesus Christ, we come before you at this time. Lord, guide us as we are gathered here. Lead the speakers who are going to speak to us this evening or this morning. And the topic that we are going to tackle today, dear God, help us so that it enables us to have impact to others. Father, those who are on the way, guide them, be with them, and see them through so that we can meet together here. Father, guide us in this short prayer that I believe and trust in the name of our Lord Jesus Christ. Amen.
Amen. Thank you so much, Veni. Thank you for the opportunity to just present us before the supernatural, the Almighty God, because we know there is basically nothing we can do on our own. Even the conversations we are having, God must lead us. God must bring the people to walk the path with us. God has to be here so that we are successful, because our aim is to make a difference, and making a difference cannot just take our own strength. As the world navigates challenges that cannot even be imagined, including stress, social fragmentation, uncertainty, and rapid technological change, we are reminded that sustainable development is not only about economic growth. Sustainable development is not only about environmental protection, or is it about technological advancement? It is a fundamental about people. When we are talking about education for sustainable development, this is education that enables us to meet our needs today without compromising the ability of the future generation to meet their own needs. So even as we are talking about mental health, we are doing this not just for us, we are doing this for us and for the generations to come. Whether they are here or not, in one way or another, we are touching on them. Because if we don't take care of ourselves, then we will not be able to take care of them. We will not be able to take care of others. We will not be able to take care of the planet Earth. When we talk about sustainability, we have to put in mind three things. That is the social, the economic, and the environmental. And in all these things, none of them is bigger than the other. They have to meet at a central place. And now that we are talking about people, we are basically now talking much more about the social pillar of sustainability. You will agree with me that healthy societies are built by emotionally healthy individuals. Strong institutions are sustained by ethical leadership. So there is no way you can talk about ethical leadership if here something is wrong. Resilient communities emerge where there is empathy, where there is compassion, where there is human dignity, and where all these are valued. This conversation that we're going to have today invites us to explore how mental well-being, ethical decision-making, resilience, and trauma informed systems can help shape a future that is both sustainable and humane. Tonight's dialogue brings together a remarkable panel of global thought leaders whose expertise spans from different areas. We are talking about psychiatry, we are talking about mental health advocacy, we are talking about governance, we are talking about the youth, we are talking about leadership, we are talking about education, we are talking about sustainable development, name them. We are deeply grateful to each of our speakers today and participants for contributing to this important global conversation. As we get started, I want us to open our minds. I want us to know that what we're going to get today is not going to start here and end here. This is just the beginning of a long, deep conversation. The time might be little, but in the sense of what we are going to gain, I believe it's going to be more than we think. So before I go deeper to even get to the point of introducing the panelists, allow me to introduce some of the pillars of the Global Alliance for Sustainability in Education. We have a team which forms the board that leads the ESD talks globally. So allow me first to invite Dr. Akama from Moi University in Kenya to just say hi. Dr. Akama, please.
Good morning, good afternoon, good evening, wherever you are tuned in from. Thank you, Ambassador Christine, for this time. I know it's 5 p.m. in Kenya. Most people are coming back from Sunday activities. But here we are. We need to learn, we need to interact, and we need to share experiences. Thank you for this opportunity and for the presenters who are presenting today. We are looking forward to hear, share, and learn. Thank you.
Okay, thank you very much. Next, we have Professor Balidawa.
Hello, good morning, good afternoon, and good evening. I am very excited to be part of this discussion for today, and we are hoping that we will learn more about mental health from a global perspective. And we are hoping that we'll take away a lot of information with respect to do when it comes to mental health. Thank you so much for this opportunity.
Yeah, thank you very much. And one of our great supporters, Dr. Asewe, please say hi. Unmute yourself. You're muted. Unmute yourself.
Good afternoon. I'm really happy to be part of this talk show today, and karibuni sana from Kenya.
Wow, thank you so much. And so, to bring to us the great facilitators, I want to call upon Dr. Ninda. Dr. Ninda, are you in the room?
Yes. Hi, how are you?
Okay, thank you very much. Thank you very much. Allow me to make you co-host first. Okay, good. Go ahead.
So, I think Dr. Ruma has joined.
We have we have Dr. Kyati, we have Dr. Amrit, we have Dr. Deepak, we have Dr. Sarah, we have Dr. Sugata. Yes.
Sugandha.
Sugandha, yes.
Yes, please.
Yeah.
So, okay, I would like to thank first of all you to give us the opportunity for the council, that is National Mental Health and Psychosocial Wellness Council. And today we are only like 5 or 6 people of the council, otherwise we are 30 members, and it is of the commerce women Indian commerce chambers, and we have the topmost psychiatrist of the country and the Prince Manvendra Singh Gohil as the member, as because mental health is everyone's business. So even the dermatologists and educationists are there. And the national president is Dr. Amrit Joshi, and the National Denim Club partner he is. So I would like to invite him only the first to just tell like how he sees the mental health future of the mental health.
Jai Sri Ram, Jai Jagannath, Namaste. So, good evening, and first of all, let me thank Dr. Aninda for bringing us together. Thank you, Global Alliance for Sustainability in Education and Wiki. It's a joint collab. And good evening and warm greetings to all the esteemed speakers, organizers, and participants from joining from across the globe. I see a lot of people from across the globe, and that's great. It's an honor and to be part of this important global dialogue on education for sustainable development in the future we collectively seek to build. We are trying to look at the future. And mental health is no longer a peripheral concern. It is central to public health. It's central to social well-being. It is central to economic productivity and a lot of things. How people think, how people behave, how people cope, how people connect, how people learn. Empathy, care, compassion, these are all central to how we develop, how we grow in life. So as we deliberate on sustainable futures, we must acknowledge a simple yet compelling truth. Sustainable development cannot be achieved without a good mental well-being. A mental well-being is paramount, is central to our development in all spheres, be it education, and the principle of leave no one behind holds particular significance in the context of mental health. It's very, very important. No one should be left behind. We have to, include everybody. So, and in the context of mental health, as the burden is often most acute among vulnerable populations, we need to look at the vulnerable populations, the vulnerable areas, be it war, be it, religious-based politics, be it children, be it women, be it the LGBT class, these are the vulnerable populations and we need to take proper care of them. And most important is the young community. There's a global epidemic of mental health in the ages of 16 to 30, which we never thought when we were 16, 18, 20, we never thought what is mental health, what is stress, what is coping, and they are the most important focus. And that's why the whole, alliance is important. Advancing mental health as a public health priority is the most important thing. And policies that, make such, the mental health to be the central point or central focus has to be encouraged. And that is why we are. So I look forward to offering a few reflections on why positioning mental health at the core of our public health and sustainability agenda is not merely important, but indispensable to building a young generation, to building a better future and a better prospect for the young generation. With this, I would like to, thank everybody for inviting me. It's an honor and a pleasure to be with all of you. And let's hope we come out better and we come out, having better ideas on how to build a better future for our children and a better today for ourselves. Thank you so much. Thank you. Aninda.
Ambassador Christine, we can start after this list.
Yes, please. If we could talk about all the facilitators or the panelists, just
one by one we can.
Okay, you want to introduce them as they give their section.
Or
Okay, go ahead.
whatever okay.
That is fine.
First of all, first talk is definitely the empathy, which is the biggest currency of the world, and I think no one can be better than Dr. Deepak Raheja to talk about it. He is the senior advisor and national executive board member of our council, and is the director of Hope Care India, senior advisor and Hope Care Foundation. His main goal is basically to unshackle psychiatry and to remove the psychiatry from the closet of the clinics and start healing in the spotlight. And he has been awarded with Excellence in Mental Health Leadership Award, Distinguished Contributions for Rehabilitation Psychiatry, and National Award for Community Mental Health Advocacy and Innovative Rehabilitation. And he has also been the member of the Parliamentary Affairs Committee for Indian Psychiatric Society, and now he's the chairperson for the Men's Mental Health Committee. And along with that, he had organized a conference that was the one of the best, largest national level conference since 2026, which was the theme was the unshackling psychiatry, and it brought too many all the policymakers, mental health advocates, and actually was a very wonderful conference. He's a specialist in rehabilitative psychiatry, long-term recovery, stigma discrimination, and gender sensitive and mental health policy. And we know him since childhood because his father was a very famous psychiatrist, and we all from childhood we know him as a celebrity psychiatrist, definitely. So he practices in Delhi. Sir, please welcome. And about empathy, we can talk. It is a
Yeah, please unmute yourself, Dr. Deepak.
Thank you. Thank you, Dr. Aninda, for a very, very generous introduction. Thank you, Dr. Christine. Thank you, the Global Alliance for Sustainability in Education, all the office bearers, Dr. Roop Sidana Saab, if he is here, Dr. Amrit, Dr. Sugandha, Dr. Khyati, all my colleagues, all the faculty members and senior officers of Wiki. It's been an honor and delight to be here this evening. I definitely am excited because it is through deliberations like this that we will eventually be able to influence the policy, because sustainability is something which is for a long time we continued to believe that it was the unsustainability. It was precious few who had some remarkable qualities to be mental health crusaders. And they were the chosen ones, and they had maybe worked upon themselves. But I think with sustainability, what the message that we want to deliver to, and like you rightly said, Dr. Christine, this is not the end of this conversation. It is just the beginning, a strong impact so that all the policymakers, the bureaucracy, the media, the governance are able to understand that war is too powerful to be left to generals alone. So mental health is too powerful and too big to be left to just a mere few of us. It is not the bastion of what we decide. It has to be a multi-stakeholder dialogue such as the one that is happening now. It has to bring forth the people with lived experiences, with patients, with carers, and then that goes on to become the benchmark of working through the stigma, which to me is the paradoxical opposite of empathy. So we've forever spoken about finance as a capital, of luxuries, of material things as a capital. But empathy as a capital is something that we want to start looking. We want to figure out mechanisms how common denominators can be established, and then training can happen across multi-stakeholders, which includes NGOs, which includes Anganwadi workers, ASHA workers, which includes grassroots level workers, psychologists, counselors. It is too big because the gap between people who suffer from mental illness, and some estimates conservatively say that over 1 billion people could be suffering from an active mental health morbidity at a given point, where the treatment gap could be as high as 75%. So, 1 on 4 is possibly the person who will eventually get help, and 3 on 4 will not get the help. And they will not get the help because not that essentially help is not available. They will not get help because they are fearful. They are fearful of being branded. They are fearful of reaching out and then being labeled as probably cuckoo. Probably in India, we use a very loose term, pagal. So they've forever grappled. So the first line workers, whether it is um, uh, basic primary health workers in hospitals, whether it is counselors, whether it is AA or NA crusaders, or whether it is police officers. These are the people who come first in contact with the mentally ill. And for somebody who has learnt about empathy at age 10 or age 15, or even at age 30 or 35 or 40, and then when he's exposed to a situation in real life, we have enough data to show that the way he's going to respond to that situation will be so different. We have been instrumental in holding some training modules for judiciary, for police officers, and they have then subsequently invited us after 1 year to say how the ground force started to behave differently. I recently had a patient who went through a manic episode, and when patients go through a manic episode, they don't have judgment. They can become extremely belligerent, extremely trying, very vocally abusive, violent. And he was in a flight, he was grounded, sent to a police station, and to the station house officer, who's a senior most officer in a police station. He, for 1.5 hours, continued to rattle obscenities of the highest order. And the police officer just spoke to me, understood his situation. I just told him that please hang in there. It could have been your child or my child in that situation. Please don't get angry. He's not a criminal. He's mentally ill. Staff is coming, support is coming, and we'll come help. And for 2 hours, the way the whole police station looked after him, was sensitive, did not get provoked, was remarkable. So, when was the last time someone truly saw one of us, and not just our diagnosis, not just my file, not just my functionality, but saw me in full humanity? So, unfortunately, because we are scientists and we must have common rubrics to deliberate and get data and to have treatment modules, sometimes we also tend to go overboard and start seeing our patients from the prism and the lens of a mentally ill, a DSM or ICD diagnosis, somebody whose GAF or functionality is at what level, and we fail to truly connect with the patient. I have come across at least if not many psychiatrists, but many psychologist colleagues who took psychology because people told them that they had huge empathy, they were very, very sensitive, they were being seen as by society as agony aunts or agony uncles, people would or agony friends, and people would come and pour their heart to them. But unfortunately, having gone through formal training, doing their bachelor's and master's, and probably it just doesn't stay as sensitive and as sharp, because what really happens is in the process of scientificalizing themselves, they possibly start losing empathy. They stop seeing a patient or a person in totality. They start looking at DSM diagnosis, and we start then looking at symptom complex and trying to fit into a diagnosis where we can quickly then come up with a diagnosis and write the treatment, make a recommendation, and so on and so forth, which is, I think, a very blunderous thing to do, because sometimes it takes a patient, a client, many, many months of deliberation to make that decision to finally be able to see a mental health professional. And those moments can make or break that therapeutic alliance, that therapeutic connection that you could get with the patient, that could go on to then start healing the patient. We all know about the Jefferson Empathy Rating Scale developed by the Jefferson Medical School, was mostly done for diabetes patient. And they found that patients who connected with clinicians, diabetologists in this case, who were empathetic, who were hugely had a lot of empathy they could exude and exhibit to their patient, the outcome of glycemic index were far more positive and far more, they came in control with much lesser doses of insulin or OHA or hypoglycemic agent, and patients recovered better. Thus was the change when patients relate to a clinician who builds a relationship, who is empathetic, and who's not just looking to put the patient in the closet or the cocoon of just a diagnosis. So empathy is a healing philosophy. We need to understand that whether it is philosophers from Levinas to Noddings, they have argued invariably that ethical encounters begin with the face of other. So as soon as we come across a person, empathy begins to happen. And as much as we are analyzing our patient is also analyzing us. The patient is also trying to make sure if he's going to continue to possess and to entrust his emotions, his confidence, and his trust into you. So, a landmark study has gone on to establish that this relationship means a lot to the patient. And when they connect with clinicians who are sensitive, whose body language does not elude them, who are exuding empathy during that interaction, the patients begin to respond positively, and they do not then carry a self-induced pain, which can lead to a self-stigma also, because the stigma is not just people. The stigma is a public stigma, which is a diabolical opposite of what empathy is. It can be a public stigma, it can be a structural stigma, and it can be a self-stigma. And the public stigma is the belief of the community, which attributes shameful dangerousness to or a moral weakness to something like a mental illness. A structural stigma is the institutional practices that begin to discriminate somebody who's already received a diagnosis. We have a lot of police officers who go through burnout, who go through anxieties and depressions, and they come to our clinic. So we got into a project with the Commissioner of Police here in Delhi, and started to provide these services free of cost as a social responsibility to lower rung officers, which were constables, which were sub inspectors who work at the grassroots level. Now, interestingly, when we stationed these mental health professionals in various police stations, you'd be surprised that the attendance in seeking any intervention or help was very, very poor. And when we actually did individual surveys to figure out that, the anxiety load was there, the depression load was there, why were they not forthcoming in reaching out and seeking help? What basic tenet, a basic denominator that we found was that these people, these officers were fearful of getting stigmatized and then the consequences thereof from their senior officers. So this is how society works. This is how society seeks and sees mental health. So as much as it is important for our patients to be seen with empathy, it is important that we are also empathetic to our own self. We have social contacts. We have healing practices for clinicians. We have pillars that would possibly exude would probably deliver empathy training to mental health professionals, which is something that WHO has also taken cognizance of. There needs to be a narrative infrastructures. Governments and media regulatory bodies must commit to mental health literacy campaigns. We must reach out, collaborate with the media so that the right message is able to go to society about mental illness and the need to seek help, because the strong message that needs to go is that to ask for help is a sign of strength and not a sign of weakness, wherein our patients continue to feel that it may be a moral weakness. They continue to grapple to understand that why did they suffer what they did and why did it happen, not understanding the phenomenology, not understanding the underpinnings and the grassroots of how mental illness is caused, which is why it is important for us to educate them, to psychoeducate them, and which then leads to also a structural equity. And the structural empathy without justice is just a sentiment. The framework must be embedded with parity in legislation, with enforcement, and not just aspiration. It must include mental health in a universal health coverage with a genuine budget. A country like India, possibly has less than 1% of its health budget as a mental health budget, which is so sad because now that we have a Mental Health Act of 2017 in India, its implementing is going to need a lot of money, and we must liaison with the government, with bureaucracy to be able to muster that fund so that that Mental Health Act does not just sit on desks as an aspirational document, but is implemented in true spirits. It's important that no empathy can be complete without looking at the empathetic lens with which we see the caregivers, which includes doctors, psychologists, counselors, families with lived experiences, families who are the first line and who are the carers of looking after them. So their burnout must be addressed. They must be provided with windows how they can get into maybe self-help groups to be able to talk to each other, to understand that they are not alone. In my years of clinical practice, I have sat across from patients who've been carrying their illness in silence for decades, not because they lacked access to a clinic, but because they had never encountered a world safe enough to speak into. Somebody called, I don't know if it was, I think it was Viktor Frankl or Thomas Saz. A lady called and said she wanted to commit suicide. This was past midnight. He got worried and he tried to engage her into that conversation for over 40 minutes, trying to explain to her why it was important to live and why she had so many reasons to have gratitude and not kill herself. The conversation ended there. He met this patient, this woman, after almost a year. She walked up to him, introduced herself, and it was very easy for him to correlate and remember this case. And he said, "Oh wow!" He smiled and he said, "So you didn't harm yourself. Out of all the reasons that I gave you, that you must not end your life, which is the one that appealed to you the most?" The lady smiled in silence and said, "None." And
Wow.
he was
Thank you,
taken
thank
aback,
you,
and
thank you, thank you.
he was surprised, and he said, "If none appeared, you're still here, so what made you change your mind?" She said, "The fact that in this world past midnight for 40 minutes, if a clinician or a human being can speak to me without any agenda, without anything to gain from, it made me reconsider that the world is still not such a bad place, and it might be worthwhile living."
Wow.
Such is the difference that we can make into the lives of people who we interface. We must not minimize the power we have in relating with people, in connecting, in transforming lives each day in and out. That safety is built when one empathetic encounter happens at a time. It doesn't need to be a million. It is a one step, but it is also built by frameworks, by legislation, by school curricula, by the priorities of international bodies like such and international colleagues like
Wow.
such. So we can take the same message across the world. Empathy as the capital means that every act of genuine witness to another's suffering is an investment. And like all
Thank you.
investments, the returns compound. A
Wow.
child who
Thank you.
learns,
Thank you. Thank you.
thank
Thank
you
you
very
so
much.
much,
Thank you.
Dr.
Thank you.
Raheja.
Thank
I mean, this is just mind blowing. I don't know how to do it. I salute you. This
thank you so
was
much.
amazing. This has been a rich and enlightening presentation from you, Doc. I know you need 2, 3 hours for us to just listen, learn, enjoy, reflect, and really move along with you. Believe me, you're going to get a full session alone. This is just the beginning. Remember, that is what I said. Now, to
Thank
ensure
you.
all the distinguished panelists have an opportunity to contribute, may I invite you to maybe think about giving us your key takeaways later, because we are going to come back to you. I want to really particularly appreciate your emphasis on empathy as a transformative force in mental health care. I will now invite our next speaker through Dr. Aninda. Dr. Aninda, please.
Next speaker, Dr. Sugandha Gupta, will be talking as about after empathy, we have to have the healthy beginnings to have a hopeful future, like from childhood and the school mental health, how it is important. So I will introduce Dr. Sugandha. She is a director of the director and consultant psychiatrist, Delhi Mind Clinic, and she is a mental health advisor for Railways Children India, and so she has experience of working in Gangaram Hospital, Army College of Medical Sciences, SR Psychotherapy Clinic. Her contributions has she is a very good poet also and a writer also, and her contributions have been she has written she has been author of Abhivyakti, that is a collection of poems on mental health, and her major interest areas are this youth mental health and the women mental health. She has specialized in adolescent mental health, and she is a national advisory board member for our council, and she also heads the Delhi Lady Secretary Society, like in which frequent events happen. And she is spouse of my teacher, Dr. Paramjit Singh, who is a very empathetic psychiatrist, as ma'am is. So, ma'am, I will just welcome you.
Thank you so much. Thanks a lot, Dr. Aninda. Also, thank you to Dr. Christine for welcoming us here and giving us the space, the opportunity, and the time. I hope I'm audible to all.
Yes, you are.
All right. So I would like to share a few slides just to give direction to my talk and the topic that I have been assigned today. So thank you to Dr. Aninda for that introduction. But as I stand here today, I just don't stand here today in the capacity of a psychiatrist or a mental health professional. I also stand here today as a woman, as a mother, as a teacher, and the many roles that all of us fulfill in our daily lives. The topic that I have been assigned today, the ethics of future, school psychiatry, and safeguarding the generational futures. So I think with Sir Dr. Deepak Raheja having highlighted that mental well-being is the need of the hour, whatever lens, I would continue it from there, whatever lens we might look at it with, whether it's the economic losses that we suffer, whether it's the productivity loss, whether it is the lives lost, the rising rates of suicides due to depression and anxiety, any which way, whatever we look at it, we are now aware that there can be no health without mental health. Sustainable futures require much more than economic growth. We need adults that are emotionally resilient, happy, content, and only then can we look forward to progress in any sphere of our life. We all know, most of us are mental health professionals here, and we have read and we are aware that most of the adult mental health disorders start in the adolescence, the young age. And it is here that the neurobiological roots are laid down. This is also the time when the brain is developing. It's the time when the brain has the capacity to learn, to absorb, to change, to evolve. Something that's called the neuroplasticity. And if we were to miss the window in this time to heal people, to generate people and adults who are emotionally healthy, it would not just be catastrophic. I would say it would be criminal. Trauma is heritable, and so is resilience. Now let us understand, where does the early school intervention fit in here in the terms of mental well-being and emotional well-being. A child who has had an adverse childhood experience, let us say he was bullied very early on, which continued, or a child underwent psychosexual abuse, and they kept it repressed. That leads to evolving into a teenage who has dysregulated emotional cycle. It could be aggressive, it could be violent, or it could be the other way around. They have internalized all the pain and have become introverted, shy, and lagging behind the peers. As they grow into the adult, as they take on the roles and responsibilities of an adult, they find it difficult to relate. Their parenting styles are not adequate, and hence they end up raising children who may again suffer from various challenges. And hence, this is how the generational transference occurs through epigenetics, through modeling, through family environment. This is again to highlight why is it important to connect early. So education systems should also be looked at like equity systems. Whether it's a developed country or a developing country, no, not every family can afford a psychiatrist. But adversity, stress, trauma does not spare any child. All children are equal. And rather, the children who come from marginalized backgrounds, weaker economic status, they are rather more likely to suffer from adversity. And unfortunately, these are the ones who will have no access to a psychiatrist. So the idea or the goal to reach out to more children at the same time, all together without any biases, would be the time when they are at school together for over 6 to 8 hours a day. And one trained counselor, one adequate screening, and one timely referral can make a huge, huge difference. As one grows older, schools shape culture faster than clinics and hospitals. So let us imagine a child who's having a panic attack, and there is a teacher who holds him in the class through that, who helps him deep breathe, who tells the class to be patient, to give this child time. It's not just that he's countering the stigma of mental health at that time, he's also training the other 39 children in that class about psychological first aid. Those children are learning why and how not to bully, not to ostracize another child, another peer who is suffering from some emotional difficulty. And hence he ends up training 30 to 40 future parents. So just see how one little act at the right time can make a great amount of difference. So early intervention in schools should not be considered optional anymore. The intergenerational role that it plays needs to be understood and highlighted. But then again, it's not easy to make this shift. In India itself, it was, I think, it's been many years since it's been mandatory for schools to have counselors to be available for mental well-being of the students. Howsoever, a welcome move was also frowned upon when it was found that when the children of a class came to know that one of them was attending a counseling session, that child would be bullied and mocked. Hence, it became to be seen as a stigma, and children would stay away. They would not reach out. So, herein, the systems views mental health as a fluid state of well being that requires environmental support and clear pathways to care. Let's understand what I mean. The aim here, by moving from stigma to system, is to treat mental well being in schools at par with academic training or physical health. So, in India, the government run schools have a yearly assessment of every child's height and weight. They are given free deworming tablets, they are given free iron supplements. Their health is monitored, physical health is monitored as much as their academic growth is. But there is no measurement of the mental well being of the child. So, the school mental health has to also be viewed as a core institutional responsibility and not as an isolated issue. This cannot be achieved through just awareness campaigns. There may be hundreds, but it doesn't bring about the change. The change can only come with trauma informed policies, teacher training, ethical screening. This can be a multi-tiered system of supports. At the first level, which is the universal level, 100% of all the students they are covered. We focus upon socio-emotional learning integrated into the daily curriculum and school-wide mental health literacy. The targeted interventions can be with the at-risk group. So maybe 10 to 15% of the class. This is a small group counseling for students who have a shared stress, children who are feeling academic anxiety, exam anxiety, or who are grieving through loss, or the family dynamics have changed. And further, the tier could be intensive, focused at just 1 to 2% of the students who are undergoing severe individual crisis. Herein, one-on-one clinical intervention can be done and coordination with external medical professionals can be done. So the structural elements of a systems approach could be first, universal screening. Herein, even the children who are masked behind good grades and silence can be picked up. Then there can be routine-based checks, just as every year eyesight for students in the school are checked or their height and weight are monitored. Similarly, there can be mood meters. There can also be dedicated quiet sensory rooms to de-escalate. And then gatekeepers need to be redefined. As I was explaining, the school counselors that were brought forth with the hope of aiding the students became a matter of stigma. So imagine if every responsible adult in the paradigm of this school was trained, whether it was the school bus driver, whether it was the sports teacher, whether it was the gardener or the class teacher. If every adult was trained adequately, it would create a whole deal of difference. Suppose a child while playing football falls down and hurts his knee. The school teacher will go and ask, "Are you hurt?" But suppose everybody is playing and a child is sitting in the corner, the teacher will not go and ask why he's sitting here. He's going to be scolded for being lazy. Nobody is going to ask if you're anxious, if you're sad, or why are you sitting here all alone? Why are you not with your friends? So if every teacher is trained, if every adult in the position of authority and responsibility is trained, it will shift the focus from punitive discipline to curious intervention. And then in today's technology, where we have data that can be collaborated in real time, that can be, reviewed regularly over time intervals, it could be used to track the trends. Suppose in every school or in most schools of a metropolitan city, the data shows that the anxiety peaks in the month of January or February, then an assessment can be made to hold one awareness campaign or a workshop in the month of December, highlighting the need and providing the resources accordingly. So if we could do this, if we could, focus at the school level, if we could target the younger adults and the adolescents, we would hold up building emotional capital. This would provide internal reserves of resilience, emotional literacy, self regulation, and interpersonal trust. All of these are essential assets that every individual, every student, as they grow up, will require to will be helped to navigate the modern world. So, school based psychiatry can act as an institutional architect to build, protect, and scale this capital. The shift or the viewpoint has to shift from deficit mapping to asset building. Right now, what do the traditional frameworks do? We identify children who are lagging behind academically. We sort them out. We refer them outside to a clinician. We diagnose, we treat, and we treat them enough to make them fit back into the conventional models of discipline, academic growth, and staying at par with their peers. Howsoever, what we need to do is we need to use this early identification tool as preservation, subclinical vulnerability, even before the child has manifested into a full-blown illness or systemic deregulation, a child has to be identified before the breakdown happens. And then, if we could do this and provide the correct intervention prior to a good time, we would stop the risk, we would reduce the damage happening, and we would also help create children and adolescents who would know that their health is a concept that is going to be malleable, that can be redefined, that can be developed, that can be evolved. So they will develop a vocabulary of agency, learning that this is a hurdle, it's a single facet of identity and not a lifelong limitation.
Oh, thank you.
So, what
Thank you so
Thank you,
much.
Dr. Christine. Can I just say one last line, just a
Yes,
concluding
yes,
remark?
yes, please.
Okay.
Yes, please. Yes.
So, all that I need to say is that moving away from stigma to a systematic approach is not just to manage a crisis, but to rewrite the terms of a student's future. When we build emotional capital within the schools, we stop expecting children to survive the environments that don't support them, but we give them safety nets, psychological safety, and the cognitive freedom that they need to thrive. In, and investing in this is not a distraction from academic achievement, it's the foundation of it. And if we have healthy children, emotionally resilient children, hopeful children, we will have a whole population as adults who will be more hopeful, who will be more active, who will be more passionate. And hence, providing growth and helping us achieve our sustainable goals at a truly fulfilling level. So, thank you so much for your patient listening. I hope I was able to communicate my ideas to some extent with
Wow.
all of you.
Wow, wow. That is amazing, Dr. Doctor.
Christine, can I just
Dr.
start a
Sewe,
bit?
no, not yet, Dr. Sewe. We will get there, please. Yeah, thank you. Thank you so much. Thank you so much, Dr. Gupta. If you could recommend one practical mental health initiative that every school in the world could implement. Maybe let's say within the next year, regardless of resources, what would it be and why? Probably
I
you
would
need to think
suggest
of,
that
yeah, you
just
have the
one thing.
answer
I
ready?
think all I do because we, connect with schools and youngsters every day. And what we come across is that we need to sensitize the teachers about mental health. Whether it's a young teacher or an old, there is still a lot of stigma about mental health, and especially at young people. So, if we could sensitize and train every single teacher, it would make a world of difference. A world of
Wow.
difference. That's all. Thank you.
Wow, thank you so much. Thank you, Dr. Gupta, for reminding us that safeguarding mental health is not simply a clinical responsibility, but an ethical responsibility. Your presentation has challenged us to move from stigma to systems, to move from crisis response to early intervention, and from deficit-based thinking to building resilient, thriving young people. Thank you very much. Now, to our next speaker, I want to hand it over to Dr. Aninda.
So after the schooling now, thank you, ma'am. It was a wonderful presentation as expected. And now I would like to welcome Dr. Khyat. She is going to, after schooling, as we all go to the college, and about in colleges and the youths, there is rise in suicide rates nowadays, a lot of, because of the comparisons are there, digital media, and lot of stress, and they don't talk. Men don't talk, and women are not allowed to talk. So there is a so about the youth mental health and the suicide prevention strategies, I would like to invite Dr. Khyati. And Dr. Khyati is a Gujarat state president for our council, and she basically is the director and owner of Sakhi Women's Mental Health and Child Guidance Clinic. And she's the honorary state secretary of the Gujarat state branch and executive committee member, Western Zonal branch of Indian Psychiatric Society. She is co-chairperson of School Mental Health Program also, and the School Education and Counseling Subcommittee. And she is ex-advisor to Public Relations Subcommittee, and she's also the ex-chairperson of the Women's Psychological Health Subcommittee. She has been awarded the Best Young Psychiatrist Award and the Bombay Psychiatric Society Award at the national award level, and she keeps on giving her views about the many issues whatever comes in the news, like about the mental health, how they are related, and she is also a very good singer. So I would like to welcome Dr. Khyati, and please. She's there.
Yeah. Thank you so much, dear Aninda. And thank you, Dr. Christine, and the whole team for having me here. It's really an honor. So I'll be talking about hope and resilience today. We all know suicide has become one of the leading causes of death among the youth, not only in India, across the world. Today's youth face pressures which the previous generations never experienced, like constant comparison through social media, which was non existent at our times, academic competition, career uncertainty, information overload, loneliness despite digital connectivity. Many young people feel I'm connected to everyone, but understood by no one. So, these are the factors which are mainly responsible. Now, if we talk about the people, the youth who are attempting suicide, see, my question is, if a person standing on the edge of despair could see their life 5 years later, would they still make the same decision today? Probably not. Why? We see that overnight the problems haven't changed, but their hope has changed. And we also see in similar adverse situations, some people break down while some fall and rise again. So, what is the difference between them? The answer lies largely in hope and resilience. So, let us talk about hope. Many people confuse hope with positive thinking, optimism, but hope is not the absence of struggle. It is the decision to believe, even inside the struggle, that something better is possible. Uh, let me talk with the psychological angle. According to Snyder's hope theory, hope has three components. One is goals, one is pathways, and one is agency. Among goal, hope is always event specific. So you must have a clear, specific, and achievable target for the future. Pathway is how to of achieving the goal. Like I can find a way to reach my goal. Even if one road closes, another can be created. And agency is the motivation, the will to traverse the road. It is like the goal is I know that I'm here and I want to be there. That is the goal. The pathway I can see. There are also alternate pathways, like if one closes, I can take the other. And agency, that is the fuel which our car, like we have the destination, we have the road, but our car still needs the fuel without which it won't work. So motivation is as important as the fuel. Now, a person may lose a job, fail an exam, or go through a divorce or experience a heartbreak. Then, hopelessness would say, I can't see any way out, so my future is over now. Whereas hope will say, maybe I'm not able to see the road right now, but I'm sure I'll find one. So my future will be better for sure. So hope doesn't erase pain, it walks with it. Hope is not luxury, hope is oxygen. Explaining biologically, the feeling of hope activates those areas of the brain like prefrontal cortex, which are responsible for goal setting, decision making, and problem solving. So, when we feel hopeful, our brains light up with the activity that helps us plan, persist, and persevere. And it has profound physical effects, like people who cultivate hope tend to recover faster from illness, respond to better to pain, they live longer. They experience lower levels of depression and anxiety. Their immune systems are stronger, their relationships are healthier. So the hope changes the brain and brain changes the body.
Wow.
Now,
Can you just repeat that? I think let's catch that one.
You want me to repeat that?
That statement.
Yeah. Hope changes the brain and the brain changes the body.
Wow. Thank you. Continue.
Yeah. So understanding resilience. Resilience is not toughness, unlike what others believe. I'm strong, I don't cry. This is not resilience. I'm pretending that everything is fine. This is also not resilience, because where there is no struggle, there is no resilience. Resilience means the ability to adapt, recover, and grow despite adversity. A useful metaphor I remember, a bamboo tree bends in a storm but rarely breaks. So it is so resilient, and we need to be like that bamboo tree. Human resilience works similarly. Research shows that resilience goes through supportive relationships, meaning and purpose, emotional regulation, problem solving skills, and community belonging. Many of the points which Dr. Christine had mentioned in the start of the session. So now, if we want to build a society, like a society which is not very vulnerable to suicide, then one thing, instead of asking, why did this person die? We must ask, what could have helped them stay alive? Where we could have intervened, what we could have recognized, what were the signs, and how we could have helped. So I would suggest that the preventive measures can be taken at three levels: individual, family, as well as society. At individual level, we can teach emotional literacy skills, coping skills, life skills, which will help them make more resilient. At family level, an advice: listen more and judge less. Be a friend to them, be a safe space where they can open up and they can trust you. And for the society, making mental health care more accessible, like in schools, as Dr. Sugandha said, in the community, and also making it stigma free, as Dr. Deepak Raheja sir said. So every conversation can become a lifeline. So a resilient society does not only prevent suicide, it also helps survivors rebuild meaning after tragedy. Hope is not denying darkness. Hope is deciding that darkness is not the whole story, there is beyond it. And as psychiatrists, educators, parents, teachers, leaders, citizens, our responsibility is not merely to treat illness, it is to help people imagine a future worth living for. And I would conclude with, when hope survives, life survives. When communities nurture resilience, future becomes better. Thank you.
Wow. I don't have words. I think I feel like I should be able to recite every line of your presentation. Thank you so much, Dr. Kiati, for
Thank
reminding
you.
us that resilience is not the absence of challenges. I mean, people keep saying, oh, she's resilient, but do they come down to analyze what it really means to be resilient and really defining hope for us? We need to get it right and define hope just as you defined. Your message challenges us to move from asking why people struggle to asking how we can support them better.
Yes.
Yeah, thank you so much. The call to build hope, strengthen families, and create stigma-free communities is a responsibility we all share. And we have to take it from the heart. I always talk about the head, the heart, and the hands. Now that we've listened to you, we take it to the head. We want to take what you've given us to the heart so that when it goes down to implement what we've learned using the hands, then it's going to be very easy for each one of us. If you could recommend one practical activity that schools could implement immediately to help build hope and resilience among learners, among the educators, among teachers, what would the activity be and why?
Uh, it's a very simple activity, I would say, not requiring very much skills or anything. Storytelling in children.
Wow.
Like we give the examples of how that if for small children, like how that rat could or how that rabbit could surpass that trouble and win, or how any of the animal or any of the child could survive in an adverse situation and could make through it. So this is basically, this creates hope in children because they can put themselves in the same situation, that okay, if I were in such a trouble and I feel that nothing can be done, but over here that person has done something, so that means a good outcome is possible and even I can do that. So I
Wow.
feel for little children, giving, like telling positive stories, somebody coming up among adversities would really create hope.
Wow, thank you so much. I know so many people are eager to say something. HRM Queen, Ambassador, please, we will give you time. Just allow the panelists to finish their discussion, and then we will open up the forum for everyone to speak. I know Dr. Deepak is there waiting to say something. Everybody is there waiting to say something. Dr. Ninda, please, bring us the next facilitator. Dr. Ninda, back to you for the next facilitator, please. Unmute yourself.
Yeah. Dr. Amrit is there. So I think I will call my dad only first, Dr. Roop Sidana. He will be talking on the mental health as a nationhood, like about the self-care and all. As Dr. Amrit's session, I will have to take, and he has gone for some meeting.
So are you calling upon Dr. Rana?
Yeah, once I call
Or Dr. Roop Sidana?
Yeah, my dad only.
Okay. Maybe you introduce them?
Okay, I will introduce.
Okay, please.
Someone else. There is some this one.
Dr. Anita, I don't. Okay, I think Dr. Roop. Is it Dr. Roop who is coming on?
Yes.
Yeah, he's there. Okay. Yeah.
Okay.
I will give your introduction. So basically, he's a psychiatrist since last 42 years of experience, and he has only taught us about the mental health, empathy, and what about hope, resilience, and everything. And as they say, behind every successful woman there is a father, and definitely behind me there has always he has always been there, and uh, he has been in the mental health aware, breaking the stigma by going into the communities. And his first thing is never to label. So labels are for jars, not people. And the physical examination in psychiatry has been his, like he always examines a person first, like never assume that a person is having just the psychiatric issue. First rule out the physical problems, and the stigma, we have to go down to the roots of the community and uh, stay grounded and talk to them, and then only we can heal, like by going to the villages and communities. And he has been the part of the Mukti program, that is the Nishkam Foundation, in which they have unchained around 120 persons who were chained because of the mental illness, like chained like animals and not given food and anything. They go to the villages and unchain them and start them on the lifetime treatment. And so, and other than that, he is into the spiritual psychiatry, spirituality and psychiatry, about yoga, healing, meditation, all these holistic practices. So, I and awards, I can't anyone else can introduce it otherwise. Yeah, he has been awarded the Dr. N.N. Gorishan Award and the Excellence Award and lastly he presented in, and his main aim has been to raise mental health awareness. And I always say I want to carry your legacy to give mental health awareness talk in every country and every city. Thank you. So he will be talking about mental health as a nation.
Welcome,
Good evening.
Dr. Ruth. Good
Ladies
evening.
and gentlemen. Yeah. Can I start my talk?
Yes,
Aninda,
please,
can you
Dr. Ruth.
share my slides?
Yeah.
If it takes too long, you can share the slides with me. I can also project. Dr. Rup, can you just turn your phone round so that you have a wider screen? We want to see you bigger. Yeah, good. Thank you.
Is that okay?
Yeah, that is perfect. Yeah, meanwhile, you can just be talking as we wait for the slides.
I've been practicing in a small town in India for the last 40 years, and my aim has been holistic care, affordable to everyone, and to reach the masses, to reach the communities. And in that, I have had a non-government organization and other volunteers helping me in spreading the awareness about mental health, and also by uh, working with the Indian Psychiatric Society at the state level, the zonal level, and at the national level. And I had good opportunity to be chair of the mental health care during COVID, when I was given the charge to take care of the arrangement of webinars throughout the year about impact of mental health in general public, in specifically mental health professionals, and listening to the stories of people and effect of media, good or bad, on the mental health and on the care of the COVID people during that particular time. And today's topic is mental health as the macro indicator for nationhood. And I would be touching upon areas of mental health and self care, and then introducing a concept of mental health nationhood index for the countries and for policymakers to see that, looking at the Can I start from the first slides? Can I start? Can you start my presentation from the first slide?
This was the first one I was sent. Which one is the first one, Dr. Ninda? Maybe you can resend so that I pick on the first one, because I picked them the way you sent them.
Most of us
send the first one. Is it? Okay, let me check. Let me check poster 3. Then there is. Okay, I have seen the poster 1. Okay, just continue. I'm bringing it up.
Yeah. Economic prosperity is generally what we look at the nations when we talk about the international comparisons. And GDP growth, industrial output, technological advancement is not only that makes the nation happy. A society may appear prosperous on paper, but struggle beneath the surface. Mental health is a prerequisite to development, not merely an outcome. Depression, anxiety, substance use disorders, loneliness, and burnout, and social distress and violence. They are all need to be taken care of and looked at by the policymakers and by the citizens at all levels. Till 20th century, standard had been of the society is physical health and academic education. Can I have the slides?
I have shared one. Is this the first one?
These are the posters. The PPT is different. These are the posters.
Okay.
This I will be coming at the end.
Okay, please send me the slides, because what I have are the. What I have are
I can speak without the slides if.
Yeah,
and
just
I can
go
share
ahead.
the slides.
Just go ahead. You'll send the slides later. Yeah, just go ahead and just speak to us. Yes.
Yeah. Am I visible and audible?
You're audible, yes.
Am I not visible?
You're okay. You're visible, you're audible.
Okay. So 20th century standard was physical health and academic education. 21st century requirements, we would look at education, physical health, and psychological well-being. Which drives workforce productivity, impaired decision-making prevention, sustained creativity, and robust social participation. Individual experiencing chronic stress demonstrate diminished creativity and reduced social participation. These effects accumulate directly, threatening the national competitiveness. So, out of the United Nations SDGs, number 1, no poverty. Psychological well-being acts as a central hub for most of them. Like SDG 1, conditions reduce employment and financial stability leading to poverty. SDG 3, good health. There is no health without mental health. SDG 4, quality education drives learning capacity, attendance, and concentration. And if there is poor physical health, we have already listened to our speakers, Dr. Sugandha, Dr. Khyati, that the school mental health is very important. SDG 5, gender equality mitigates challenges of discrimination and caregiving burdens, and people gender inequality leading to domestic violence and unhealthy female population and others. SDG 8, economic growth directly contributes to workforce and occupational performance. So mental health Psychological well-being is important for all the goals to be achieved. Reduce inequalities, psychological support, psychosocial support is critical for reducing the social exclusion, and SDG 16, peace and institution, vital for social trust. Mental health is vital for social trust, empathy, and conflict resolution. We have already listened to the speakers about the education systems, which are important in making the psychological well-being of the public in general. Children spend their most formative years within educational institution. If mental health is the foundation of sustainable development, education is the primary vehicle for delivery it at scale. So when we combine these two, I think instead of looking at the academic achievement and knowledge transfer, we must look at the emotional growth and identity formation in children, and social skills, values, and community connection and ethics. These need to be taught throughout the schooling and in the college. So from formative years to lifelong resilience, mental health care is important. And education system and schools are very important part and place for the mental health. Academic obsession. We have seen that people who score good marks or top in the board exams or in the universities, they turn out to be poor in their practical life. Even the medical students who excel in their exams, later on in practice, they may not do so well. So it's not just academic performance, it is the overall development of the personality which is important. And focusing just on examination and performance in the multiple choice questions or performance in the case presentation, we need to look at the conflict resolution, adaptability power, stress management power, recovery from setbacks. So a sustainable education model must integrate mental wellness alongside academic excellence to build lifelong resilience. So the integration of mental health and mental wellness from the school till the education and the workplace is important. Self-care is a rigorous educational competency. Emotional literacy, identifying, understanding, and communicating emotions effectively. Somebody says that knowing about the top leaders of your country is less important than knowing what is anger, what is anxiety, and how when you feel sad, and what to do when you are feeling angry. So this must be taught. Stress management, utilizing breathing, mindful techniques, and reflective journaling against academic and social pressures need to be taught in the schools. Physical wellness, prioritizing sleep, nutrition, and recreation as biological baselines. Digital well-being. Now is the time for digital use. Everybody is using social media, internet, and phones, and digital well-being, navigating the cyberbullying, social comparison, and screen addiction. As Shati said, that cyberbullying and social comparison has been the source of stress for youth nowadays. Social connectedness, fostering inclusive environments and for belonging and psychological safety. This is all important. So self-care is often misunderstood as a luxury. So mental health or mental wellness is not a luxury or personal intelligence. In reality, it is a critical life skill that must be taught systematically within schools. And in India, we have the age-old ancient techniques, the spirituality, yoga, and meditation, which can be integrated very easily. I am involved with a school here, which is till its standard, and yoga and meditation is an integral part of their curriculum from the beginning. And we have seen that students coming out of the school are doing well in their life. Apart from mental health in schools, we must look at the teacher well-being. It's a load-bearing structural infrastructure. If the teacher is not well, he's not happy, he's stressed out, he will not be able to teach his students or give a model to the students. And so workload, administrative responsibility, behavioral changes, performance pressure. In our country, we have seen that teachers have been overloaded with work, even in the small villages and towns. Apart from their regular teaching ability, teaching work, they have to be involved in the census, they have to be involved during elections, and uh, take care of the polio administration and many other activities. So they are not just involved in the teaching work. So the threat is emotionally exhausted teachers cannot effectively nurture emotionally healthy students. Promoting teacher mental health yields improved classroom climate, better student engagement, reduced burnout, and hence enhanced educational outcomes. Conclusion, teacher wellness must be viewed as an investment, not an expenditure. As I already said, Indian wisdom, the Bhagavad Gita, Buddhism, yoga, mental study, they are models for psychotherapy, they are models for counseling, and they can improve the mental steadiness amidst success and failure, equanimity, awareness, and compassion, leading to mindfulness. And along with that, the modern neuroscience, contemporary scientific evidence about enhanced intention, emotional regulation, and biological stress management, neuroplastic resilience. So we have to combine the ancient philosophical traditions with modern neuroscience to improve the outcomes.
Wow. Wow. Thank you so much. Thank you so much, Doc, for Dr.
The
Sidana.
future of sustainable development depends not only upon technological innovation or economic growth, it shapes resilience in the face of adversity and determines whether communities thrive or fracture. Healthy minds, strong minds, sustainable futures. Thank you.
Wow, thank you so much. Thank you for reminding us that sustainable societies require mentally healthy citizens. And mentally healthy citizens are nurtured through emotionally healthy schools and supported teachers. Dr. Sidana, if governments could introduce just one mental wellness competency into every school curriculum worldwide, which competency would you prioritize and why?
I would prioritize meditation.
Meditation. I was thinking about meditation. That is amazing.
Which doesn't take any money, it doesn't cost anything. There is always an assembly in the morning before the classes start, just 5 minutes or 10 minutes out of that. And in the end, when their students are about to leave, 5 minutes again for meditation. I think that could help students as well as teachers reduce their stress levels.
I think you're gonna teach us meditation on this forum so that every presentation we start with meditation. Because I think that is more neutral for everyone. Thank you very much.
Yes.
Thank you, Dr. Sidana. You've actually reminded us that mental health is as important as economic wealth. Your presentation has challenged us to move beyond academic achievement and consider the emotional, the psychological, and the social competencies that enable individuals and societies to flourish. The message is clear. If we want sustainable futures, we must invest in both learner well-being and teacher well-being. And now the forum is open for the audience now to bring in their insights, to ask their questions, and for everybody to feel like they are part of this important conversation. There are two people who had already shown interest of saying something. I want to start with Dr. Asewe, and then we come to Queen Ambassador. Dr. Asewe, was it a question? Was it an insight? What was it? Unmute yourself. Okay. Queen Ambassador, HRM Queen Ambassador, please unmute yourself. Both of you are still muted. Anybody else? If you wanted to ask a question.
Afternoon.
Yeah,
Hello.
good afternoon. Please introduce yourself and tell us where you're joining us from.
Hi, I'm joining from United Kingdom.
Wow.
So how is everybody?
We are all doing
thank,
well.
thank you very much, Dr. Aninda Sadhana, for inviting me in very last minute. I was like, okay.
No, I did in the morning. You did message, but I will introduce. She is Queen Letitia and Madam Kaponsiki. Also, she is known as because she is a well-known singer, founder of Bentley Records, and she has written a book that is Restored. That is about her own life journey and how the resilience is, and she talks wonderfully about the resilience and hope. And the Restored is about her life journey with the bipolar illness and the ADHD, and she is a very strong lady, and she is into all the humanitarian activities and also the media, the movie making and the channel and the singer. She's a very good singer. That is a Bentley record she started, and now also she sings. And her movie recently got awarded in the Jalgaon, Aurangabad also, and in Sikkim, the best film festival. That was a What Bipolar Didn't Tell You. What
Wow,
they
she
didn't tell
should
you about bipolar.
she should
Yeah.
be part she should have been part of the panelists. But you're gonna get another opportunity to tell us more about your work and
Okay.
inspire us. Yeah, just tell us something small.
Well, with my book Restored, it's been starting to get rolled out into different institutions within Nigeria, and we're also now starting to try to provide exercise books, resources to different orphanages within different parts of Africa, especially more of the rural areas. So with the book Restored, it's very much your own restorative journey with oneself within life. And I believe that within, regardless whatever industry that you are within, whatever journey and chapter you are within your life, there's something that each and every one of us all experiences it, but we experience life in different ways. And the very suchness of love in itself, when many people don't experience even what that is, and that can be very overwhelming when people start experiencing that. And so that very relationship starts with how one is with oneself, and through the healing, through the traumas which may have been carried through different of generations of stuff that's not been having the support there, it takes into consideration an intergenerational perspective as well on restoration from different angles. So yeah, I hope that you lot can get to check out some of our links to be able to hear some of the audio of the book, or to find out about the book or the details, to keep in touch. That would be really great.
Wow, thank you so much. Thank you so much.
You're welcome.
Would like to know more about that book. Please join the group. There's a group we created for mental health awareness. You can join the group so that you can share the links there, so that everybody in this forum, everybody should join that group, so that everybody gets access to all the materials that
Okay.
have been used today, and many more, and many more. Dr. Aninda, I can see Rabia Patel. Rabia, you would like to say hi to the team? And please tell us where you're joining us from. Then Dr. Sewe can come on board.
Oh, hi. Yes, sure. Would love to speak on this Mental Health Awareness Day, and such a beautiful people speaking up, and of course sharing. Because unless and until you share what is your mental health going on, you can't heal yourself. Thank you for making me a part of it, Dr. Ananda. I love you.
Wow, amazing. Thank you, Dr. Asere. Go ahead.
Hey, let me just say good evening, good afternoon, wherever you are. Thank you very much. The discussion has been very tense, very interesting, and very good. In fact, what we are hearing from our co-panelists is good. I just want to talk on resilient framework structure, which my friends have just talked about, especially emotional strength in citizens' actions is anchored into so many ways. Like now, the skills in schools, empowerment programs in places like places of work, access to counseling services. My friends have just taken some few points which they were talking about, like counseling sessions is very, very important. Apart from that, improving and coping with the skills and the systems, increased family problems, especially in poverty level, parenting, bringing up children in very dynamic environments. Those are some of the things which we need to talk about. And then another thing we need to look at is the indicators, especially in the family life, reduced family conflicts. When there is a certain indication that somebody is saying, I will do this, I'll do this, we must take that one into perception, and it must be very, very serious. Another thing is increased social support networks. Most of our people, especially our young sisters who have just gotten children out of wedlock, sometimes they are being neglected and the stigma comes in. So you may find that the marginalized the communities within a society sometimes brings a lot of problems. When you look at the institutional resilience schools and police forces, as my friend have just talked about, in the workplace, schools, mental health integration into curriculum could be a factor in this case, whereby self-reporting situations could be seen. In our forces, mostly in the police forces, trauma is most being informed, especially in the training complication sessions, when they are arresting, when they are going to arrest, and what they are seeing in their perspective places of work sometimes affects them. So if we can integrate all these things into workplace, could be another thing. Employing well-being programs should be enhanced so that our people can work stress-free management, supporting places. Stress management is another factor affecting the sustainable development, and we must look at the indicators, especially reducing violence and unrest, staff well-being levels, response effectiveness. When you look at the national law and the government policies, right now, most of the national governments in the whole world have not integrated the mental health policies to favor the communities. Even the funding services have not been done. So if we can integrate all those things, and then the data system is being monitored into well-being, then we shall look at the suicide rate, sustainable development goals 3, 4, and 2, which is access to mental health care and youth employment stability. Nowadays, the
Thank you so much. Thank you so much, Dr. Sewe, because we need the panelists to give us their final word before the time is done. I want to request that you can write your views either in the WhatsApp group or on the chat, because we still have a lot from our facilitators, the panelists, and definitely you're going to give us more. You're going to give us more of your insight. Yeah.
Let us make healthy struggling into policy. That's my take.
Yeah, thank you so much. So every facilitator is going to get at least 2 minutes to give us their final words. And I will leave this to Dr. Ninda to present to us one facilitator after the other. At
Yeah,
most,
first of all,
at
I will
most,
send you
at most
pictures of
3 minutes. Please make it at most 3 minutes. Your
yes,
your
I
final
sent you the
words.
picture of the book Restored of Letitia. You can show that on the screen like once. Her book pictures I have sent you.
Oh, the pictures.
Yeah, pictures of the book
Oh, I have to
about
be.
like that's the journey. It's about from broken to beautiful and rising to the purpose. Like I even also wrote a poem, Broken to Beautiful.
Okay.
I have sent 3, 4 pictures. Yeah.
Yes, so I will start with this one.
So she is. This is her book.
I've posted the Hollywood one.
One.
You seen it?
Yeah, it's okay. Next you can show.
Then I have this.
About the book, yeah. You can enlarge it once.
I can't be able to do more than that. Okay.
A book, and it is not only a book, it's a movement. It has about the over how to overcome pain and setbacks and heal the mind, body, and the soul, and how to rebuild your confidence and identity, step into the purpose, destiny, and inspire everyone and rise despite the struggles. She also is struggling with fibromyalgia, and still she is going on being strong and uh, inspiring everybody and into the humanitarian works. And this is a movie which I got many awards. It was like exact name. It is what if what we didn't tell you about bipolar. Like it's about the level.
Okay.
It has a
Thank you.
podcast. Yeah.
Thank you very much. So can you now invite to us the facilitators one after the other? Although we have so many comments on the chat, Christine Owino is requesting to know how to apply meditation in the competency-based education.
So, yeah. So
Let me
my
see if there
father.
is any other question from the chat. Asha, founder of Know the Power of the Mind initiative in Kenya. Glad to be educated a lot on mental health issue, especially focusing on preventive measures in school as a public health officer. Quite informative. Thank you so much. Any other concern from the chats? Discourse, that is good. Okay, Gertrude is talking about looking at the widespread indulgence into drugs and the resultant effects on mental health. So in the process of our panelists talking about what they have, please, if there is anything from the charts that you can address, go ahead and talk about it kindly. Thank you so much. And we had our very first person who joined the forum from Botswana, Themba Amos. Before the panelists can come, can you just say a word? Themba, you've been listening from the beginning to the end. Any insights that you've taken home, what you can share with the team on board?
Good evening, beautiful people.
Good evening.
I've been here, and we are learners. We're coming in like we are standard ones in school. But what I've really learned is a lot, especially creating awareness when it comes to these issues of mental health, because it's something that I really believe it can improve the lives of the people. Because I think in every country or in many nations of the world, we see lives being lost, and like even here in my country, we cannot pass when you haven't had people that have committed suicide, that have killed one deaths are always there, but normally there is never, much to look at in terms of, looking at the things to do with mental health. I want to believe this is something that needs to be preached so much across the world. And I'm quite very, very impressed to have been part of this forum because I believe I'll learn a lot and I'll probably network with a lot of people around here. One of the days I wanted to believe I'll make a better presentation. Thank you so much, Doc, for recognizing me. That's why I'm always coming a little bit early to at least be the first one to get
Thank you, thank you. Thank you so much for presenting Botswana really, really well. I want to see the people from other countries. Please introduce yourself in the chat, because I know we have different countries represented here. Of course, Uganda is always here, full-time, Ghana, Tanzania, Canada, America. I know Israel is always here. So if you're from any other country, just feel free to introduce yourself. And if you want to connect with people from all over the world, that is very good. Jane Ondiek, I can see you've raised up your hand.
Yes, I'm Jane Ondiek. I come from Kenya.
Yes, Jane.
I really enjoy the deliberations that are helping us in our day-to-day lives. May we continue with it because it will help us a lot. Thank you so much to the facilitators and to our officer.
Awesome. Thank you so much. Dr. Fantastic.
Fantastic day to you all. Lovely to see you all. All you kind humanitarians out there. As you all know, or hopefully you know, I'm founder of the Foundation for World Harmony. We've proclaimed September 21st as World Trust Day. Hope you all join us on that day, spreading trust. We need to trust ourselves. We need to trust others. We need to trust our governments, and we need to trust in our future. And we are the kindness revolution, asking everyone to be kind to themselves, be kind to others, and be kind to Mother Earth. That's all we ask. We don't ask for money. It's not a business. It's not a political association. It's for kindness. We have 120 wars going on right now. It's too many. It's 120 too many. We have too much greed. We have too much poverty and a bad education system. So the Foundation for World Harmony is in 151 countries. We're over 17,000 people strong. And we're out there to show the world that we need a new consciousness. And that's my little statement.
Awesome. Thank you so much. And you know what, Dr. Fantastic? The education for sustainable development, big question for us has always been, what if each one of us could learn how to take care of ourselves, how to take care of others, and how to take care of the planet Earth?
Well, let me address that quickly.
Yeah.
Einstein, one of the smartest people in history, once said, there are two things that are infinite, the universe and human stupidity. And I'm not sure about the universe. Well, that statement resounds what I feel the situation is on the planet. And I call it the insanity of humanity. What I just stated, the too many wars, too much violence. We're a warring species. So the Foundation for World Harmony and the Kindness Revolution has made it real simple for humans. 3 simple commitments, which you just stated, solve all the problems in the world. So the way to address a changed world, a new consciousness, is to be kind and love ourselves, to be kind to others and treat them as we want to be treated, and to protect our planet by using less and buying less and recycling and repurposing and reformatting. I've got 6 websites, all social media, 3,000 videos on YouTube, all addressing how to love yourself, love others, and love the planet. And that's my mission. I want you all to join. It's free. You can go to worldkindnesslist.com and join. You can send me a text and with your information, and I'll make you an ambassador of kindness. We need more kindness in the world, and we have what's called the Global Kindness Pledge, and we want every school to recite it. In Africa, it's being recited all over Africa, and it's helping the children. It's creating self-confidence. It's spreading energy to the classrooms. It's fostering camaraderie, and it's working. And I hope you all will join and help me making the world a kinder place.
Awesome, awesome, beautiful, fantastic. Please share your contact and share your links. Please join the WhatsApp group so that you can share to many people.
Sure.
So, Dr. Aninda, please wind up for us with the facilitators.
K.Obaigwa sir has left. He had to leave for some social. He had prior commitments. So I would like to call, I would like to call Dr. Sugandha once.
Thank you, Dr. Aninda, and thank you, Ambassador Christine. It was really very enlightening and a beautiful, beautiful interaction with people from all over the world leaves us more inspired. And if I were given just 2 to 3 minutes to highlight what I brought forth, I would like to go backwards. You know, we had these sustained development goals, 17 all in number laid down in 2015 to be achieved by 2030. Now, not a single one of these goals can be achieved if the people in leadership positions, the responsible adults, were not empathic, were not emotionally resilient, were not compassionate. Each of these adults who's in a responsible position of authority and leadership was a child once. So, if we want a future tomorrow that is fulfilling, that is successful, that is uh, great for all, we need to work with our children today. We need to help our children grow emotionally resilient, happy, content, hopeful, motivated. And that cannot happen behind clinics and hospitals. We have to reach out to each and every child on the planet at the place wherein all of them are treated equally. That's the school. So, school mental health holds a great deal of potential to achieve the sustainable goals beyond just education and individual well being. It's to strengthen a nation, society, our planet. Thank you so much.
I would like to call my dad, and I'm sending the presentation. Like, can just to give him 10 minutes more because that was I could
Four
not give the
posters. I have
presentation.
four for 5 minutes. If you can
Yeah.
project the poster, share the posters
Yes, yes,
one
I'm
by one.
sending.
4 posters. Just to re-emphasize, mental health is the foundation of nationhood. Healthy minds build strong nations. The future wealth of nations will depend not on how much is the GDP or how much is the industrial growth, but the psychological well-being of their people. Healthy minds will bring better education, greater productivity, stronger communities, higher resilience, and better public health. Can I have the next? Like we have the infant mortality, the maternal mortality rates, the age expectancy, and the incidence of heart disease or non-communicable diseases across populations as the indices of the. So we should have the national mental health nationhood index, MHNI, and I propose that we have 8 components of it, and we can go one by one. The psychological well-being, which means the life satisfaction, happiness, hopefulness, purpose in life, and quality of life. Thriving individuals build thriving nations. Second, mental illness burden, the various incidents of anxiety, depression, suicide rates, substance use disorders, and disability adjusted life years, all these indices. And third, the educational mental wellness, school counseling and anti bullying systems, mental health literacy among students, and student well being, and teacher wellness. All these must be part of the mental health nationhood index. Healthy minds and stronger futures. Healthy schools. Then social cohesion and connectedness. In this world, when we are virtually connected to most of people, we forget our neighborhood, and we forget our family. And social connectedness leads to trust, community participation, family stability, and social support, and loneliness prevalence is very high and can become a disease by itself. Connected communities create resilient societies. Next, eight
Well put.
domains: the workplace environment, workplace mental health is very important. This year, we are looking at the workplace at mental health at the workplace, and in reducing the stress, connecting with people, and training the managers to look at the mental health, reduce the stigma of mental illness or stress among their workers. Access to mental health care to all, irrespective of age, educational background, and economic level. Care within reach, hope within every life. Next is digital well-being. In this era of digital life, we need to look at the well-being, looking at the WhatsApp addiction, the gaming addiction, and overuse of social media, and comparison of our activities on social media like Instagram will create definitely be important. And finally, national resilience and crisis response also should be developed. And so, stronger systems, resilient societies, and sustainable future. That should be our motto. I think I'll end with this, and stronger societies, resilient societies, and stronger nations. That's my, and empathy, compassion should be the uh, task for everyone. Thank you.
So you have 10 minutes, 5 to 7 minutes more to just show the presentation.
I think we can share the presentation to the team.
Yes, yes.
It's still okay because time is up.
10 minutes, yeah.
Yeah.
Can we have 2.5 minutes meditation in between?
Yes, I think because of somebody who was concerned how they can use meditation
I'll
with
just
the
see
students.
if the
Yeah.
speaker is working.
Compound.
It's not
Thank you so
working.
much. Thank you so much. Thank you so much.
Wonderful journey.
Okay, I think we will do meditation.
Yeah,
Let's do
I'll share
meditation
video.
at the end.
Can you play
Dr.
the
Ruth,
video?
Dr. Ruth,
Yes.
can we just do meditation at the end so that we give Dr.
Yeah.
Dr. Kiati a chance to just give us her last 2 words. Then we will finish with meditation. Yeah.
Yeah, I would just wind it off very quickly. For making children resilient, I would give a few words to the parents that they should first teach their children how to take a no. They should teach their children how to handle failures, and it's okay to fail. It's not necessary to win every time. We cannot get everything what we want. This needs to be taught to the children. They should not provide each and everything what the child asks for. Let the child struggle. Only then the child will develop resilience. And for hope, I would say, like whenever we feel very broken or very hopeless, like now it's the end, there's nothing for me left now, then just tell yourself that the story isn't over yet. Tell yourself that the best days will be still come ahead. Also, however dark and long a night may be, the daylight still follows, and healing is possible, and that inside your chest there is a small flame, flickering, persistent, sacred, and that is hope. Don't let it go. That's it.
Wow. Don't let it go. Dr. Siguda, did you give us your last word? Whom did you say left? Dr. Siguda is here.
I have already given my last few words.
Yeah.
Thank you.
Yes, everyone is done. Like, I think you want to present, Papa.
Start looking at some.
So no. Yeah, I think then we can do the meditation. Then we call it a session. Now, each of our presenters today will get a day for themselves, Dr. Ninda. And Dr. Ninda, I must say thank you very much for giving us such powerful speakers, and you yourself being so powerful, for the coordination, for everything you've done for us as a world forum. We appreciate everybody from all over the world for taking time just to be here, to be part of this conversation, not just being part for purposes of sitting here and just be seen, but I believe we've all been engaged, deeply engaged. The conversations were deep, and I believe from here we are getting something to take to somebody else. Let it not just be about us. Remember, education for sustainable development goes beyond I. It goes to us. It goes to other people. Please share what you have learned, and we're going to share the recording. Definitely share widely. Let the whole world know that we had this forum and there is an impact that has already been created. And so let me invite your Papa now to take us through meditation.
That's like from next time, can we change the day, because it's Sunday here and we all get only one day. Like everybody had something, and Dr. Khyati also had to cancel, and my father and Ma'am Sugandha Ma'am, everyone had to cancel some program, and other people could not join. So that's why like some other day can we keep like for the wiki.
Okay, we'll talk with the board. We'll discuss how to go about it, because it took us a long discussion to settle on the time and date. But we will definitely take into consideration the request and see how best to move forward so that everybody is included. Yeah, because I know right now in India, it's going to almost midnight.
Yeah.
Thank you. Thank you so much for the
Thank you for the
consideration.
sacrifice. Yeah, thank you very much. Dr. Roop, it's your turn. Take us through the meditation, please.
Can you see a picture?
Yes.
This is our teacher who teaches us meditation, Swami Vishwasji. He is a religious spiritual leader, and I'll try and play the audio. Inner journey, taking a tour of Vishwas meditation into an inner terrain, a wonderful journey from stress to serenity, from tension to tranquility.
Hey,
A wonderful inner pilgrimage. Let us start this meditation process.
Sit comfortably with your back straight and your eyes are closed. Start looking inside. Keep looking on. Be seer, be witness, be observer, be non-doer for some minutes. Then see inside. Simply watch. Do nothing. Keep looking on. Oh, 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 Omkar.
Hello?
Yes.
Was it audible? Because I was playing on my laptop. I will share the video to the to you with an email or WhatsApp through Ananda, so that you can listen to the video as well. It is a demo meditation for 2.5 minutes, but usually we go to 30 to 40 minutes, and it's there on YouTube as well, and it's practiced by many of the people here and abroad. Thank you.
Thank you so much, Dr. Roop. I was able to go far. The moment we were told to close our eyes,
Yes.
I saw the picture of the whole world.
Yes.
And so that is what we can do. Meditation is very, very powerful. Very powerful. Thank you. I think we're going to learn to do this even on our platform here so that we can introduce meditation to everybody slowly by slowly, so that those of us who are having students, they can introduce meditation to the students. And so I don't want to end it by myself, and I have my team here. Let me request Dr. Akama, please, in a special way, can you appreciate our guests?
Thank you, Ambassador Christine. I've been meditating and I'm still meditating. I'm trying to see where are we going, where are we coming from. The journey has just started. God, give us the grace, give us the time, give us the resilience so that we can adjust and learn more. This was an eye opener. Thank you, Dr. Sidana. Thank you, Papa. You know, when I hear him saying, Daddy, you want to present? It makes me feel nice. You have handed over the gift to your daughter, and your daughter is still singing the gospel together with you. And for the other presenters, we can't thank you more. You have spent your evening, you have spent your Sunday, you should be sleeping, but you are sharing to the world. We are giving hope to the mind so that the mind can transform our lives. Wow, that was my take-home message. We appreciate you, we love you, and we wish to hear more from you. Asante sana, and in Kenya we say karibu tena. Thank you.
Awesome. Awesome. Thank you so much, everyone. I hope with the meditation, it will go deeper and even beyond prayer. May you continue meditating the whole week until we meet again next Sunday, or whichever day we will now choose as a board. We are going to have a serious meeting on it. If possible, we might maybe have 2 sessions in a week, you never know, to be able to accommodate everyone. Thank you very much and have a fantastic week. I hope everybody joined the WhatsApp group so that you don't miss out on some of the things that were being shared. Thank you and goodbye. We love you all.
Goodbye.
Okay.